We're at a really exciting time now in the islands of working with our partner agencies. We're having lots of integrated workshops, and not only are we learning about other people's roles, but we're identifying ways that we can work together much more effectively and efficiently for the good of the people of our islands, with a lot less crossover, more streamlined services, and better care delivered closer to home. So people are seeing the right person at the right place and the right time.
What we are able to do on Scilly is to forget the organisation that we work for and consider ourselves to be working for the team here on Scilly, which has got really big benefits to us as staff. From a patient perspective, it means that we can make the best use of resources. So we're not a patient isn't treated by me working for the health centre; they're treated by us working for the whole team, which means that we are able to be very patient focused in the way that we approach patient care.
So on the ground, what we do, well, what we have done is we've pulled all our teams together. So we've created a multidisciplinary team, which we meet every day. We have a longer session on a Wednesday and we identify all our high risk patients. We discuss them thoroughly. We share the caseload out. We try and pull all the tasks. We share the tasks across both health and social care. We're looking at our joint clinical and operational leadership across clinical and social care.
The one that really stands out at the moment is with my dad. When he came out of this hospital and went home, when the carers came in, they knew exactly what they were doing. They knew exactly what was wrong with Dad, and that had all been handed over from the hospital. They'd had a really good handover given to them. And being in work, I suppose I'm a bit of a control freak, and I felt a little bit out of control because I hadn't done it. And then it was such a relief to see them that they knew exactly what they were doing and what was wrong and how to manage it because they'd had that handover.
A case study that comes to mind is somebody that had had urosepsis come into the hospital. We did 24 hours of diagnostics, so we used our enhanced point of care treatment and diagnostics, started them on IV antibiotics, quickly moved them over to oral antibiotics, got them out towards the care home. They spent 5 days in the care home amongst the care team that actually see them in the community, so they had lots of continuity. We were able to support them using our hospital at home model, and that meant that the confidence within the care home grew, and their scope of practice has grown, and they were confident with the support and the supervision they were getting from that team, who then had a safe discharge back into their home and made it back to baseline, had a really positive experience. So
yeah. Prior to all of this being introduced, what would have been that particular person's pathway of care?
Very, very fractured, and likely they would have been flown off to the emergency department at Treliske on the mainland.
It's just the fact that you've got all those specialities pretty much to us at the end of a phone, and to have that on the islands where we've always had to, contact somebody and, it's a big process. To have that here is such a benefit to everybody. And for us, it takes that worry away, of, is he okay today? Is he not okay today? Well, we'll ring them up and they'll give us that reassurance. And then if we have any problems during the day, we know we can ring them and they will give us advice. So for us, it's a really, really good way of working.
People on Scilly are quite resilient, but they really want to be treated here on Scilly rather than go to the mainland. If we didn't have this integrated approach to care, we wouldn't be able to make the best use of resources we have, and people would end up either going acutely in a helicopter for their urgent care, or having to travel much more for outpatients or for trips to the mainland. Really, by having an integrated approach, we can keep as many people here as possible, and we can also help to bring in virtual and remote services from the mainland to help patients here and stay here as long as they can.
Being a Scillonian myself, I'm related to quite a few of them that I end up looking after. And it's just a privilege to be able to help them in their hour, especially in an hour of need, and being there to reassure and hold a hand, or just it's just lovely.